I want to talk to you about something you do every single night without thinking about it, the position you sleep in. You might assume that how you sleep doesn't really matter as long as you're comfortable. But the truth is, your sleeping position can have a significant impact on your heart, your circulation, your breathing, and your overall cardiovascular health, especially as you get older. Research has shown that certain sleeping positions can affect blood flow, put pressure on your heart, trigger irregular heartbeats, and even worsen existing heart conditions. Other positions can actually help your heart work more efficiently and improve your sleep quality. Let me tell you about a situation that opened my eyes to how important this really is. A gentleman in his late 60s had been experiencing episodes where he'd wake up in the middle of the night with his heart racing and feeling short of breath. He'd been to multiple specialists, had various tests done, and everything came back relatively normal. His heart condition was stable, his medications were working, but these nighttime episodes kept happening. When someone finally asked him detailed questions about his sleep habits, they discovered he always slept on his right side, had done it for decades. It was just his comfortable position. They suggested he try sleeping on his left side instead. Within 2 weeks, his nighttime episodes decreased by about 70%. Within a month, they were rare occurrences instead of happening several times a week. All because he changed which side he slept on. Today I'm going to explain which sleeping positions are best for your heart health, which ones you should avoid, and why it matters. This information is based on cardiovascular research and what we've learned from thousands of patients over the years. Let's start by talking about the position that causes the most problems for heart health. The worst position for your heart, sleeping on your right side. The sleeping position that's most problematic for your heart is lying on your right side, especially if you do it night after night as your primary sleeping position. Now, I want to be clear, sleeping on your right side occasionally isn't going to cause a heart attack. But if this is how you sleep most of the time, especially if you're over 50 or have any heart concerns, it can create issues. Here's what happens when you sleep on your right side. Your heart sits slightly to the left of center in your chest, not directly in the middle like many people think. When you lie on your right side, gravity and the weight of your organs can put mechanical pressure on your heart. This position also compresses a large vein called the vena cava that returns blood from your body back to your heart. When this vein is compressed, it reduces blood flow returning to the heart, which means your heart has to work harder to pump blood effectively. Studies published in the European Journal of Heart Failure found that patients with heart failure experienced worse symptoms and poorer sleep quality when sleeping on their right side compared to their left side. The research showed measurable differences in heart function based on sleeping position. Right side sleeping has also been associated with more frequent episodes of atrial fibrillation, an irregular heartbeat that increases stroke risk. When you're on your right side, you're more likely to experience heart palpitations, irregular heartbeats, or the sensation that your heart is racing or fluttering. There's also the issue of acid reflux, which might not seem directly related to heart health, but it actually is. When you sleep on your right side, stomach acid can more easily flow back into your esophagus due to the anatomy of your digestive system. Chronic acid reflux doesn't just cause heartburn. It can mimic heart attack symptoms and in some cases trigger actual heart rhythm problems through nerve connections between the esophagus and heart. For people with sleep apnea, right side sleeping can contribute to airway collapse. When your breathing is compromised during sleep and your oxygen levels drop, this puts additional stress on your heart. Sleep apnea is a serious cardiovascular risk factor that increases your chances of high blood pressure, heart attack, stroke, and irregular heartbeat. Think about someone who's been sleeping exclusively on their right side for 30 or 40 years, and they have a heart condition that's being managed with medication. Everything checks out fine during daytime appointments, but at night their heart struggles. They wake up gasping for air. Their heart races. They feel anxious but can't figure out why. In many of these cases, the sleeping position is compressing the vena cava, putting mechanical pressure on an already compromised heart and making it work harder exactly when it should be resting. When these individuals switch to sleeping on their left side instead, the improvement can be dramatic. Better sleep, fewer symptoms, less nighttime anxiety. The first few nights might feel uncomfortable if you've been a lifelong right side sleeper. But within a week or two, most people notice a real difference in how they feel. The best position for your heart: sleeping on your left side. For most people, especially those with any heart concerns, left side sleeping is the optimal position for cardiovascular health. Your heart is positioned on the left side of your chest. When you sleep on your left side, you're sleeping with your heart, not against it. This position allows gravity to work in your favor. Blood flows more easily through the aorta, your body's main artery, when you're on your left side. The vena cava, which returns blood to your heart, runs along the right side of your spine. When you sleep on your left side, you're not compressing this critical vein, which allows optimal blood return to the heart. Research has shown that left side sleeping can improve circulation and reduce the workload on your heart during sleep. For pregnant women, left side sleeping is strongly recommended because it maximizes blood flow to the fetus, and the same principles apply to heart health in general. Beyond cardiovascular benefits, left side sleeping also helps with digestion. Your stomach and pancreas hang naturally on the left side of your body, so left side sleeping allows stomach acid and digestive juices to flow downward due to gravity. This significantly reduces acid reflux and heartburn, which, as I mentioned earlier, can actually affect heart function. Your body's lymphatic system, which helps remove waste products, drains primarily to the left side. Left side sleeping may enhance this drainage process, helping your body eliminate toxins more efficiently during sleep. For many people, left side sleeping also helps keep airways open better than other positions, reducing snoring and sleep apnea episodes. Better breathing means better oxygen levels, which means less stress on your heart. To make left side sleeping comfortable, place a pillow between your knees to align your spine and reduce pressure on your hips. Use a supportive pillow that keeps your neck aligned with your spine. If you tend to roll onto your right side during sleep, place a body pillow behind you to prevent rolling over. Some people find it helpful to sleep on the left edge of the bed, so there's less room to roll. If you've always been a right side sleeper, transitioning to the left side takes patience. Your body has developed habits over years or decades. But the cardiovascular benefits make it worth the effort. Back sleeping, the second best option. Sleeping on your back is generally good for your heart and overall health, though it's not ideal for everyone, and it's not quite as beneficial as left side sleeping for cardiovascular function. The main advantage of back sleeping is that your weight is evenly distributed with no pressure on any side of your body. Your spine stays in a neutral position if you use the right pillow. There's no pressure on your heart from either side. However, back sleeping has some significant drawbacks for certain people. It can worsen sleep apnea and snoring because your tongue can fall backward and partially block your airway. This is a serious issue because sleep apnea puts tremendous stress on your cardiovascular system. If you have acid reflux, back sleeping can make it worse, especially if you sleep completely flat. The horizontal position makes it easier for stomach acid to flow back into your esophagus. Some people with heart failure find back sleeping uncomfortable because it can make breathing more difficult. When you're lying flat on your back, fluid that has accumulated due to heart failure can make you feel short of breath. If back sleeping works for you and doesn't cause breathing or reflux problems, it's a perfectly good option. To make it work better, elevate the head of your bed by 6 to 8 inches or use a wedge pillow. This helps with both reflux and breathing. Place a small pillow under your knees to maintain the natural curve of your spine and reduce lower back strain. Just don't use a pillow that's too thick. Your neck should be in a neutral position, not bent forward. And if you snore or have sleep apnea, back sleeping might not be your best choice. This is something worth discussing with your healthcare provider. Semi-reclined sleeping for specific conditions. Some people with certain heart conditions benefit from sleeping in a semi-reclined position, essentially at an incline of 30 to 45 degrees rather than lying flat. This position is particularly helpful for people with congestive heart failure who experience shortness of breath when lying flat. This condition is called orthopnea, and it happens because when you lie flat, fluid that has accumulated due to heart failure shifts toward your lungs, making it harder to breathe. People with severe acid reflux that doesn't respond to medication or position changes may also benefit from sleeping semi-reclined. Some people with sleep apnea find this position helpful as well. The best way to achieve this position is with an adjustable bed if possible, or a wedge pillow specifically designed for sleeping in an incline. Don't try to create this position by stacking multiple regular pillows. This can actually make things worse by bending your body in uncomfortable ways and causing neck and back pain. If you need to sleep semi-reclined, it's worth investing in proper equipment designed for this purpose. Some people find a recliner chair works for them, though this isn't ideal for long-term sleep. The key is finding what works for your specific situation. What's right for someone with heart failure might be different from what's right for someone with sleep apnea or someone with no cardiovascular conditions at all. The worst position overall, stomach sleeping. If right side sleeping is problematic, stomach sleeping is even worse for most people, especially as you get older. When you sleep on your stomach, you have to turn your head to one side to breathe. This puts your neck in an unnatural, twisted position for hours. Over time, this can lead to significant neck pain, stiffness, and even nerve compression. Your spine is also forced into an unnatural arch when you sleep on your stomach, which can cause or worsen lower back pain. These musculoskeletal issues alone make stomach sleeping problematic. But there are cardiovascular concerns as well. Stomach sleeping can compress your chest and diaphragm, making it harder to breathe deeply. This means less oxygen during sleep, which stresses your cardiovascular system. The pressure on your chest when sleeping on your stomach can affect heart function and blood flow. Many people who sleep on their stomachs have done so since childhood, and it's an incredibly difficult habit to break. But the health impacts, both musculoskeletal and cardiovascular, make it worth the effort to change. To transition away from stomach sleeping, start by sleeping on your side with a body pillow in front of you to hug. This can provide some of the comfort of stomach sleeping while keeping you in a healthier position. Use pillows strategically to make stomach sleeping uncomfortable or difficult. Place them in positions that make it hard to roll onto your stomach. Elevate your upper body slightly, which makes stomach sleeping less appealing naturally. Be patient with yourself. Changing a lifelong sleep position takes several weeks, sometimes months. But most people who successfully make the change report feeling much better. Less neck and back pain, better breathing, improved sleep quality. Why sleeping position matters more as you age. You might be wondering why sleeping position becomes more important as you get older. Why didn't it matter as much when you were younger? As you age, your heart becomes less efficient. The heart muscle can become slightly stiffer and less elastic. Your heart doesn't pump blood quite as efficiently as it did when you were 30 or 40. This means that any additional mechanical stress, like the pressure from sleeping in a suboptimal position, has a more significant impact. Your blood vessels also become stiffer with age. This process, called arteriosclerosis, means your circulatory system is less adaptable. When you compress a major vein like the vena cava by sleeping on your right side, a younger, more elastic vein can adjust and compensate. An older, stiffer vein has more difficulty, which can lead to reduced blood return to the heart. By age 50 or 60, many people have developed some degree of high blood pressure, coronary artery disease, heart valve problems, arrhythmias, or heart failure. Even if these conditions are well managed with medication, they make your heart more sensitive to additional stressors, including sleeping position. Sleep quality naturally declines with age. We spend less time in deep sleep and wake up more frequently during the night. Poor sleeping position can worsen this age-related sleep disruption, creating a cycle of poor sleep and cardiovascular stress. Many people over 50 take medications for blood pressure, cholesterol, diabetes, or other conditions. Some of these medications can affect sleep quality, cause nighttime urination, or interact with sleep position in ways that younger people don't experience. When you were 30, your heart could easily compensate for suboptimal sleeping positions. At 60 or 70, that compensation is harder and the effects become noticeable. This doesn't mean you're fragile or broken. It just means you need to be more thoughtful about factors that affect your cardiovascular health, including something as simple as which side you sleep on. Practical tips for changing your sleep position. If you slept the same way for 40, 50, or 60 years, changing your sleep position can feel impossible. But it's absolutely doable with the right approach. Use pillows strategically. Body pillows are your best friend when changing sleep positions. They can support you in a new position, create barriers that prevent rolling to your old position, and provide comfort and security. For transitioning to left side sleeping, place a firm pillow between your knees, use a body pillow to hug in front of you, and put a pillow behind you to prevent rolling onto your right side. Make gradual changes. Don't expect to completely change your sleep position overnight. Start the night in your new position. When you can't take it anymore, you can move to a more comfortable position. Over weeks, you'll naturally spend more time in a healthier position. Most people find that within 6 to 8 weeks, a new position starts to feel natural and their old position actually feels uncomfortable. Address underlying issues. Sometimes people sleep in certain positions because of pain or discomfort. If you can't sleep on your left side because of hip pain, you might need a better mattress, a pillow between your knees, or treatment for your hip issue. Address the root cause rather than just forcing a position change. Improve your sleep environment. After 50, you might need a different mattress than you had when you were younger. Medium firm support works for most people. Side sleepers need good pressure relief for hips and shoulders. Back sleepers need adequate spinal support. An adjustable bed can be helpful if you need elevation for medical reasons. Be patient and persistent. Some nights will be better than others. You might have setbacks where you revert to your old position. That's completely normal. Keep trying. The health benefits of proper sleep position are worth the temporary discomfort of change. The goal isn't perfection. The goal is spending more time in positions that support your heart health rather than stress it. Even if you can't stay in the optimal position all night, every hour you spend in a heart-healthy position is beneficial. Let's recap the key points about sleeping positions and heart health. The position to avoid is right side sleeping, especially as your primary position. This can put mechanical pressure on your heart, worsen heart arrhythmias, increase acid reflux, and compromise breathing. The best position for most people is left side sleeping. This optimizes blood flow, supports cardiovascular function, aids digestion, and helps with lymphatic drainage. Back sleeping is the second best option. It distributes weight evenly and keeps your spine neutral, though it's not ideal for people with sleep apnea or severe reflux. Semi-reclined sleeping benefits people with specific conditions like heart failure or severe acid reflux when other positions don't work. Stomach sleeping is the worst position overall. It causes neck and back problems, compromises breathing, and puts pressure on your heart. These positions matter more as you age because your cardiovascular system becomes less efficient and less adaptable. Small stresses that didn't matter when you were younger can create significant issues after 50 or 60. The good news is that changing your sleep position is entirely within your control. You don't need medication or surgery. You just need the right information, the right tools like supportive pillows, and the persistence to make the change. Your heart works for you 24 hours a day, every day of your life. While you're sleeping is when your heart should be able to rest and recover most efficiently. The least you can do is give it the best possible conditions to do that. If you found this information helpful, please share it with family members and friends, especially those over 50 who might benefit from understanding how sleep position affects cardiovascular health. Small changes can make a significant difference in heart health and quality of life. Sleep well and take care of your heart.